Welcome to the Iconic Scholar Podcast. I'm your host, Andrea Kessler, co-founder of Scholarnetics 360. Get ready to journey beyond textbooks and learn from healthcare's brightest minds. Each episode is packed with insights and wisdom from industry leaders, uncovering the lessons and experiences that shape their careers. Join us to unlock the secrets to your successful career and discover the innovations shaping healthcare's future. Remember, while we're here to educate and inspire, we are not offering medical advice, just fun, educational, and authentic conversations. Okay, let's begin. Welcome to the Iconic Scholar. I'm Andrea Kessler, your host. I'm happy to be here with you and my co-host, Eder Garavito. Hello, Eder. Happy to be with you.
Hi, Andrea. Thanks for having me. I'm so excited about the guest we have today because you're going to introduce them here briefly, but I know literally nothing about the amazing things that they do. So I'm just really grateful that you invited me to be your co-host again today.
Well, let me tell you, we have two amazing people joining us today, and I was very blessed to be part of an amazing group of people through the Norton School of Lymphatic Massage Institute. And the program is a new one. Nicole Somas, who's the leader, she created the Somas method for certified cosmetic surgery therapists. And this program really opened up my world as a physical therapist, especially with my past experience as an acute care therapist. But not only that, I met nurses, occupational therapists, OTAs, PTAs, massage therapists. I met so many people who are doing amazing things in this area, and it's growing. So yeah, before we get too involved here, I want to introduce our two guests. First, we have Andrea Garcia. She is a physical therapist from Brazil. Yes, I said Brazil, Eder. It's amazing. She has over 20 years working with pre-op and post-op patients. Andrea came to the U.S. She lives in Connecticut, and I'm so excited to hear her journey. Our next guest is Erika Castro. She is from Dallas, Texas, and she's an amazing licensed massage therapist with over 12 years. Her treatments are amazing because she goes into nervous system regulation and lymphatics with all of her clients, and she's taught me quite a bit during my time with her. So welcome, ladies. Thank you both for being here. I'm so excited to talk to you, learn more about what you're doing with the Certified Cosmetic Surgery Therapy credential that you just earned. So why don't you both tell us a little bit about why you chose to take that course and your history? We'll start with Erika.
Okay. Hi. Hello. So why I chose to take that course. So it's a funny story. I am in a group on Facebook. It's called Badass Body Workers. So it's massage therapists from all over the country. And I had inquired about a good accredited program to learn more about post-op cosmetics because a lot of my foundation is in manual lymph drainage with close training. And there was a woman there, Haley, and she private messaged me and was like, I've done it through, ACalls, and Norton with Nicole Somas is the cream of the crop. You get a lot of knowledge. Nicole is amazing. And I was like, sold. So I went to go look. And at the time, I was just going to take the face. They had a course, which is facial cosmetic. And that was like late last year. And then this year, they decided to kind of fuse the face and the body. And I'm really happy that it happened the way it did because it's just, my mind is blown with the knowledge. My brain hurt a little bit after 6 days of a lot of information, but it was just, the course was really invaluable. And I'm already using what I learned with my clients right now.
I have to say I've used a lot of it already too, and it's amazing stuff. It's a great course, but you're right. Your brain does hurt after that course. Andrea, how about you?
Yeah, also my brain is like born off the course. Definitely. Yeah, about this course, I have a friend, she took the course in New York, and she's talking about the course for me, and I was like so excited because I've been working post-op in Brazil for a long time, and I want to get my certification here, understand more the rules here, how the things works here. and now the base or how you guys working here, what's the difference in here in Brazil. And like I learned a lot. It's a lot of like, a lot of knowledge. Nicole is amazing. She know a lot. She share everything with us. And yeah, that's why I decided to get my certification, start work here as well as a post-op.
Yeah, huge shout out to Nicole Somas. Eder, I know you probably don't know who Nicole is.
No idea.
She's a physical therapist who worked at Weill Cornell in New York
Mhm.
City. And I believe, and tell me if I'm wrong, ladies, but she had one patient ask her to come home, to come to her house and do a home treatment after her surgery and cosmetic surgery. And as a result, her clientele kept growing and she created this method because I think she's taken a lot of other therapists who've questioned her along the way. Like, is this necessary? This is elective. Why are we doing this? But the truth is that she's caught people who've had DVTs and life-threatening conditions following these surgeries. And she's saying, why aren't we involved?
Absolutely. Was that something that was covered in the course, like how to do differentials? Did you all learn during the course, aside from how to treat patients who had cosmetic surgeries, right? Like to rehabilitate them, did you learn how to assess for signs or symptoms of blood clot or any types of other things like skin conditions, ailments, tissue dysfunction, joint dysfunction that correlated, of course, with the material and the content that you were there to learn?
Oh yeah, definitely. She's cover everything. She's like, yeah, we can like she show us to understand and doing some tests for DVT. She show us it's kind of inflammation. You have to refer back to the doctor or have to stop work for the patient because something's not right. She show us to know what the patient needs, up and down, look at him or look at the patient and say, oh, he needs that, he doesn't need that. So yeah, she's guiding us really well about those stuff.
Definitely. I agree. I feel like she really helped us like really assess the person. Like they may be coming in and they're, a post-op breast lift, but you're also assessing the whole body because she's giving us indication things that we can do, looking for contraindications. And it was just really informative, especially for me. I like to be extra careful because with this, you really have to kind of make sure you pay attention because I can't practice outside of my scope, of course. But as a massage therapist, if I see something, I mean, I even learned it when I got my manual lymph drainage certification, especially DBTs, taking a very thorough intake is like of the utmost importance before you even put your hands on people. So it's not like we're just learning. They're like, go out into the world and fly free. It's like there's rules here and let's follow that to for the patient or client's best interest. So it was awesome.
No, I love that. It looks like, I mean, seems like a very comprehensive course. I'm going to turn to my Andrea here for a second because I'm curious. I've known her for a few years, and I've known her as a director of clinical education. I've known her as an educator, and then she tells me she's going, I don't know to which state to take a cosmetic surgery course. So I just learned about why you both took the course and why it interested you. But Andrea, how did you find this course, and why did you decide to go?
Oh, yeah. So I have to tell you, I love acute care, but I love outpatient. And also working in pelvic health, I had a patient who had diastasis recti repair. And following the repair, she came in and she said, oh my gosh, it was a horrible, horrible recovery. She said, he basically told me he gave me a tummy tuck, which is common following that. But she didn't feel like she was guided in the right direction following her surgery after diastasis recti. So I started doing some investigating, and that led me to understanding the role of swelling, all the pieces of Nicole's method. And then I found Nicole's class and I thought, you know what? This isn't just good for cosmetic surgery alone. I mean, that's what she focuses on the courses for. But I really think this could help pelvic health therapists because so many of our patients postpartum, I mean, so many of them are dealing with scarring and issues that complicate their recovery process. And it honestly, Eder, it's so comprehensive. As an occupational therapist, She covers ADLs, positioning, bed mobility. I mean, diet, nutrition. She really is an excellent program, but it is so comprehensive. But I guess my next thought is understanding that we have physical therapy, occupational therapy, massage therapy in the room right now. Really, the comprehensive approach is a team-based approach. Who else do you two like to bring into your treatments? Do you ever bring in nutritionists? I know there's lymphatic massage therapists. Who else could be part of this team potentially?
I feel like for me, I work with an acupuncturist actually. And so it's very common in Texas to have several people. You can have a nutritionist, a massage therapist, a chiropractor, and so what in the same area. So for me, I may not work directly with a chiropractor, let's say, but a lot of my clients have a wellness team. And I think those are the people that have the best results, and whether it's post-op or whether it's just general wellness. But like for me right now, when I was treating a post-op facelift, I was working directly with a surgeon, and he had sent me a letter and we're talking, and he'll text me or email me, and he's like, post irregular, she's having a little bit, I'm just keep an eye out on the scar. And I'm like, okay. And you just kind of work together to really just get your client the best results. So I mean, for me, it's like it could be a surgeon, it could be a chiropractor. I would also refer out to other massage therapists, maybe someone that specializes in myofascial that I think could benefit a client. It's good to have a wide network, even of people who may be in the same field as me, but specialize in something else.
Yeah, I agree with Erica. Yeah. I think my experience in Brazil, the OT and PT like workers almost the same. But in Brazil, I can tell more about Brazil. But we had a nurse, we have a nurse assistant, we have a psychologist and the team. I think is very important as well because, some people just looking for cosmetic surgery for another goals, not exactly like to shape you on it. We have specialists, but now you learn with Nicole about the garment as well, like how to fit the better garment to fit your patient. And you also have, and the doctor included.
Andrea, you bring up a good point. The one thing I learned quite a bit about was the importance of wearing garments. So, Eder, garments are
At her space.
compression garments. These are compression garments that need to be worn. They need to fit a certain way and be worn 24/7 for a period of time. And really, the outcomes command that these are worn, and some surgeons don't require them. There's garments for the face. And Andrea, you probably can share so much more information.
Definitely, the garment have to fit very well, otherwise can compromise the result of the surgery. Yeah, you have like to get out from the surgery place, the hospital and whatever this facility, and you have to earn the garment after right away your surgery and stay like Nicole show us like 48 hours. But like I said, in Brazil, some doctor ask you just 24 hours to take it off and put it again. But you have to stay like 24 hours. Just take it off to take a shower and that's it. Shower, not bath, just shower. A quickly shower, just like to clean, take it off and change your garment, and next day just change or have more or the same one. That's like mandatory.
What is the main purpose of these garments?
Yeah, the garments like they keep like how say at the beginning I can say oh the patient like feel more supported. Yeah, they were like supported.
Is it for patient comfort or is it for actual rehabilitation?
No, for rehabilitation, I say like to explain. Even like that is support a lot the patient for edema, help not swelling that much, help not get like the skin like make some lines. They also prevent fibrose. So it's a lot that's going on. If you just a really good garment.
Yeah, the garment's really important because it provides that compression. And like Andrea said, if they get rolls and if there are any wrinkles, if they're not fitting well, then it can actually cause like complications.
Complication, exactly. Yeah. More fibrosed. If you like make the wrinkles, like the liner said, it's really hard to break that down. Really hard stuff.
Yeah, and I just got to thinking when you mentioned complications as a clinician who does not treat these patients, and I've worked with more patients that are highly sick and acutely ill. I never really put two and two together that really what we're talking about right now is outpatient elective cosmetic surgery. So, of course, if I'm going to pay thousands of dollars, I don't want to end up with wrinkles and creases. I want to have a nice, smooth transition from the surgical sites.
Yeah, that's why that's very important. Like the pre-coat, like pre-op is very important because a lot of patients just come to you. I didn't know that's gonna happen. I didn't know I cannot work the next day. I didn't know about this. I didn't know about that. I didn't know I have to like get like 10 different garments. I didn't know I have to spend money and drainage, like lymphatic massage. I didn't know about to take some meds after the surgery. I didn't. So I don't know what's really happened if they really don't ask because they think like just a cosmetic surgery. I just go do it and okay, I'm done.
But what's interesting, Andre, is like I've never had cosmetic surgery myself. So to be honest, I wouldn't know any of this information if it weren't for somebody like you or Erica that would educate me on these things. As a consumer, if I were just to think today, I want to get a nose job, to be honest, I'd Google something. I'd Google a surgeon. I'd say, well, this surgeon has great reviews, and I'd go see them, get the consult, and get my nose done. I would never, ever think about all the other things you described. I don't know if it's just America or United States, or is it Brazil's better. We'll talk about that, but I never would have put them together.
I think it's important. I just want to say, like, after taking this class, one thing I've learned and I'm very passionate about now is like the education is lacking severely for people who are getting plastic surgery, which is really wild because you're spending a lot of money and these aren't surgeries that are just in and out. And so I think after taking this class and learning about Nicole's method, like Andrew was saying, the pre-op is so important. The education about you should be lowering your salt intake because that's going to be leading to more swelling. You shouldn't be walking out in the heat after your surgery because, you expand. Like, it's just things people don't think about. And it is just really crazy. And so I am just more excited than anything to help my clients, like, especially pre-op. If I can get to you before you Google or TikTok or Instagram who the best person is, I want to be able to educate you and walk you through that journey because the surgeons are doing their work. They care about the results, how you get to the results. You're like, look, they do get an outline for sure. They'll get a guideline of this is the position you should be in. Don't do this, don't do that. Try to lower salt. But I think like it's up to us, especially as STs, to really give that extra detail and go that extra mile to explain the whys because the whys aren't always explained. And so people are like, oh, I'm fine. I just had a facelift. I can sleep just on my back. You absolutely can't. So
I would have that's what I would have thought.
yeah.
Well, why not? My face is in the front. I'm just going to sleep on the back. So is that kind of the same knowledge and education that you have, Andrea, from where you practice?
Yes, it's the same. But like I said, even in Brazil, they like make the same mistake. But they're like at the past. Now it's more like knowledge for people, and then they know how it's going on. But at the beginning, I have to educate everyone, say you have to do this. But it's like I feel I don't know here, but in Brazil, like the doctor, the physician, I would say towards you, like indicate you to do that, to education the patient, because usually the physician don't do that. Just if you like have like a checklist, okay, I'm gonna ask you this, but patients never doing that. They expect the doctor gonna tell everything. But for the doctor, it's like everything is normal for them. How am I gonna say about the garment? It's like, oh, everyone knows, but it's not like that. Like you said, it's not like a simple like Erica said, in and out, and okay, I'm done, and it's okay.
Well, this is news to me, to be honest. I have a question. Andre, you said something earlier that I had to write down because I need to ask about this, and I'll ask you both this question. But there are shows like on TV like Botched, right? And Nip and Tuck and all these things. And of course, we hear horror stories of surgeries and things of the like. You mentioned earlier that part of what you do, Andrea and Erica. I don't know if this is also what you do too, is sort of coaching some patients of what surgeries perhaps to avoid. Are you ever directly involved in coaching or informing patients to not do not get a cosmetic surgery procedure of some sort, whether it's because they've had too many or just it's just not good, for lack of a better term?
Yeah, that time I when you ask Andrea asked about the team, I add psychologist because I had one patient. She's like every year I've done like lipo every single years, like constantly, and she's like gain some weight and do lipo, and gain weight and do lipo, and then the surgeon say I'm not gonna do you anymore, and
They go to another surgeon. Yeah.
and yeah, she go on another surgery, and then she didn't explain, she didn't tell anything about it, and okay, let's go be done, and she did the surgery again and over. I said, okay, no, you cannot do that. That's not good for you, and explain everything. And I tried to stop her, but
From my understanding, which is very minimal, cosmetic surgery in its different capacities can become an addiction for some people.
yes, exactly. That's the psychologist is a really good fit
That's
for that.
brilliant. Erica, have you ever been involved in anything like that?
So, like for me, I know it's more of a coaching and a guiding. 'Cause I know Nicole talked about she's had people like that. And it's like I can't tell them what to do and what not to do. I can give them the information of what I think that they should be doing or guide them, but it's up to them essentially whether they're going to do it or not. But it is like people that I know or clients that I've had that have had multiple cosmetic surgeries. It's almost like a high that they get because, Americans now, what do we want? That instant gratification, that instant satisfaction. And elective cosmetic surgery is so much more. Every year, if you look at the statistics, it's growing and growing and growing. Right now, in the past, I want to say 2 years, facelifts have skyrocketed. Facelifts, neck lifts, and like anything with the face have really, really skyrocketed. And I just feel like people get that high. You look like this, you want to look like this. And I feel like everybody, and Nicole said this in the class, and I was like, thank you. I've been saying this for years. I feel like everybody has a little bit of body dysmorphia. And so everybody, you get your nose fixed, you're a brand new person. Okay, maybe I'll get lipo this time. Okay, maybe next time I'll take some out of my arm and put it here. And it just starts to be a continual thing. But it's important to have people around you, a good team. I know even some surgeons that would be like, okay, I understand, but no, we've already done this, 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 and this. So some surgeons will also, coach that I'm not going to do this with you. We've done 5 in the last, 2 years or whatever. So
Yeah, and I mean, I think part of the issue is that the vast majority of these surgeries are cash based, so there's no insurance related charges. So you give me the money and I'll do it. I'm curious what you both think about this in terms of your opinions. Do you feel, or kind of which end of the spectrum do you feel that cosmetic surgery should fall under? Should cosmetic surgery be reserved mostly for disfigurements and trauma versus I want to change my look?
Mm. Yeah, that's hard to answer. I don't think so. I just think like the surgeon have to know like and be open for the patient and say, okay, you're gonna do that. So if you wanna lose some weight, you wanna just shape. If you like have like 10 pounds, 15 pounds extra, the result's gonna be different than if you have just 5 pounds extra. So be clear the result's gonna get it and what you want to do or what you're keeping to maintain that result. So I think it's like more education as well, just the pre and post op, than like, oh, not gonna do that. That's my thought.
Real quick, before this class, Eder, that's a really good question because before this class, I actually in my head was thinking reconstruction versus cosmetic surgery, right? If it's something to fix a disfigurement or another body issue, right? How am I going to feel after this class? And I think Nicole did a great job at identifying, again, back to what I had said previously, So many people ask themselves that question. It might be a morality question or a central compass question, right? But at the end of the day, these are patients who have had surgery and they still need our care. My view about cosmetic surgery changed significantly throughout this course because I was able to appreciate it more. I think I got educated really as a health professional about cosmetic surgery and what it does for people. The why for why they do it is a personal thing, but the truth is still something that needs to be treated. So I guess for me, I kind of feel like I have this broader view and lens to cosmetic surgery because I've talked to therapists who have said, well, really, it's elective. So people, do we really have to jump in and help people if it's elective? They're choosing to have the surgery. There's a lot of people who've had that view. But at the end of the day, I think my opinion's changed. I don't know, Erica, if I articulated that well. I think we kind of discussed this a little bit
Yes,
in our class.
I agree. I feel like it's been a growth for me. I mean, I want to say you asked me 10 years ago about cosmetic. I'd have been like, why are people doing that? Do the work out, figure it out. And, now I'm here. I have friends that have had it for different reasons. Either they've had multiple kids and there's their stomach is different, or they want to get a breast reduction because they have back pain. Like it's just so broad now. And I agree with you when the why really doesn't matter to me anymore. And it's more so like, this is your choice. It is up to you. Let me at least help you so that you can recover the best that you can. Because, Eder, when I tell you the lymphatic world is it's like the wild, wild west right now. And the fact that you have people who are not licensed, not certified, and are literally, if you have like a lipo wound or anything or incision, they're draining blood out, like they are oozing out of it. And it's really like if you just go on TikTok or Instagram, it is everywhere. And so it's really a battle right now for those of us who are certified and who do want to give proper care to educate, because everybody thinks that's normal. And they'll be like, I had a lymphatic massage, whether, post-op, and it was really painful. That's a red flag. It should never be painful. So, circle back to your question, I think it's just really up to the person. I'm just here to support you through that journey. I'm going to treat somebody who had an elective facelift the same as I would somebody who had to have reconstructive surgery because they had a double mastectomy.
And I think what y'all just described is really an outstanding and excellent clinician where you're able to really remove yourself and your own emotions and potential biases from what patients are doing and just focus on the rehabilitative process. And all understanding that you have done your very best to provide pre-surgical education. And if the patient still decided to go through with it, you're still going to help. And I think we need more of that in our just, in healthcare. I have just one more question that's just been burning in the back of my mind. Again, I don't do plastic surgery of any sort, but something that I always, my wife and my wife's in healthcare also. We always laugh at little things that happen here and there on TV. Shows like Grey's Anatomy. There's a lot of drama. It's a lot of fun. You see all these things happen, and then you're like, wait, I work in a setting like this, and that is not how it happens. That's not how it works. This is so not true.
Mhm.
What are your thoughts about how plastic surgery or plastic surgeons for that matter are portrayed on TVs and reality TV and things of the like? Is that really how it is in real life?
Well, from my experience, first of all, thank you for I used to love Nip Tuck, Eder, and I'm gonna go watch it back again with a different lens. I promise you. Now that I'm like looking for stuff, but you know, from the plastic surgeons that I've worked with, and as Nicole was saying, it is just like I feel like any other doctor, or there's just a wide array, and how they're portrayed. They mostly are very outgoing. It's almost like there's like a certain just air about a plastic. It's almost like if it was a lineup, I could pick it out. I feel like some things hold true and some things do not. Just like same thing for massage therapists. There's a certain PT, PTOTs. Like I can always spot a PT when I tell you if I'm in a class. I just took a craniosacral class and I could spot the PT like dead to rights. So I feel like It's just it just varies, I feel like some of it is true, but just like anything in TV, they're gonna add that extra to really just elevate it. But some stuff is like that's spot on. Yes, they are like that.
Erica, I have to ask, so what did you pin me as?
You
PT
know,
or OT?
I was thinking this. The thing about you is because first day we were at the same table, you were like a stealthy little like fly on the wall. Like you were there, but you were just kind of in because you were on the edge. You were just kind of like doing your thing in your little corner. There, I could check your energy. Your energy was very nice, but I was just kind of like enigma because like I can usually spot people. But it's almost funny because you're like dual license. I was like, that's probably why I couldn't pin her. But when I started working with you, I was like, she's giving PT energy for sure.
Oh, wow. Okay.
You were like, look, this is like, but it's great because you were like, I want to learn, I want to do it right, and I want to do it efficiently, period. And I was just like, look, we're going to get it. Here we are.
Yeah, and Erica was my partner, so I learned a lot from her.
Oh,
And Andrea,
that's good.
Andrea, can you talk to us a little bit about the physicians in Brazil? I know you mentioned earlier that they really push patients your direction for their post-op
Yeah.
care, and they say you're not going to get better if you don't work with Andrea. I mean, that doesn't happen here. How can we get there?
Yeah, I wish I can know as well. Uh, I don't know here. Yeah, but like I told you, that's at the beginning. I just start like show him my results. I talk for him, and the patient like giving him my feedback about why I treat the patient, and slowly the physician starts like understand more. I did a lot of education, and then slowly he gonna like he starts like giving me more patient and more patient, and he starts saying, okay, if you not do that, if Andrea, if you not do your post op, if Andrea, I'm not gonna guarantee the result. So because I think it's like slowly he is, I think it's the same because at the beginning, like in 1998 when I start, yeah, everything was like new as well there. But then I start show day how they progress, how the patient recover, how I can speed it up the recover. So and then also like the name is gonna like growing as well as mine. So and then we kind of like work together and the result is better and then everyone's like be happy. That's a kind of I did in
What a
Brazil.
compliment. That's
Oh, a huge compliment, right? It doesn't seem like even in the US or in Brazil, the standard of care is to have PT, massage therapy, or OT post-surgical, post-cosmetic surgery. And so it seems, Andrea, that you grew your own client base because of how great you were doing. And that's a huge compliment.
Yeah, I feel like results speak for themselves. You can get on a surgeon's radar if they're going to see, they're doing their follow-up as well. And they're like, oh, you're looking great. Like who, what have you been doing? Oh, I've been going to so-and-so for my, post-op lymphatic. And it's left and right when it comes to surgeons. Some old school surgeons can't really see the benefits yet of lymphatic. Some newer surgeons are like, yes, I know, I've read the, research, it's great. But if your results will speak. So if you're working with somebody and they are progressing well, you will get on a surgeon's radar very quickly.
And so how does that work for you, Erica? Because specifically as a massage therapist, and forgive me if I'm incorrect in this, but you don't bill insurance, correct?
Some massage therapists do.
Okay.
I choose not to. I feel like it's a headache as far as because there's a couple things, they'll bill insurance or people will want to use like their HSA or something. And some therapists actually do take that and that's a viable like an option for them. Most therapists now though will give you a receipt and like you're gonna battle the insurance because going back and forth with insurance no. So, but yeah, you can definitely, some therapists do choose to do that.
I love the idea of the team approach. I'm being an OTPT, obviously, right? But massage therapists, it would be so cool if we had even personal trainers because what happens is our patients, even your clients, Erica, when they're done, they still might need that care, that tune-up. Think about somebody who's had a stroke, right? And we were talking about cosmetic surgery, but if somebody who's had a stroke, back to your point about insurance, we're expensive when it comes to care, and we can't stay with our patients forever. So having that team approach, as we were talking earlier, I was thinking about this situation. I was working as a concussion therapist in a clinic, and everybody kind of had their specialty. So I was doing concussion work and vestibular work. And there was another therapist who did the orthopedics. And he was a newer guy, and I was getting to know him. We weren't too busy, and this gentleman walked in, and he said, "Yeah, I just lost 200 pounds. I had bariatric surgery, and I'm weak, and I need care." And the therapist was like, "Yeah, we don't do that here." And I thought, why don't we? Because he needs more care. And then I thought, well, then we need to not just say we don't do that. We need to have a warm handoff. Erica, do you feel like therapists, and I want you to feel comfortable talking, but do you feel like therapists are open to those warm handoffs to you as a massage therapist? Do you think we do it enough?
So, I feel like before, probably not, but that's like a huge model. Like most of my classes, I go to Austin, and I mean, like almost everywhere in Austin, you have some kind of collective where it has and some will have an MD, some will have a chiropractor, some will have like a whole village. I think it's happening in Texas. That happens a lot. We have a lot of areas with health collectives, very much so. And like for me, I also pull on my personal references. So I work with a physical therapist. I was going to her for my knee. She, referred me to a pelvic floor PT. My trainer, the physical therapist I go to, she's in the gym. Like she has an area in the gym. So she's working directly, with that. So my trainer will send somebody to me because she heard they want a lymphatic. And it's just this beautiful community, but it's also me getting on social media, and I've gone to therapists, for a massage or whatever. And so now if I know somebody that has pelvic floor issues, guess what? Now I know a great pelvic floor PT that I'm just starting to see. So it's really finding that community. And I feel like a lot of the people I'm surrounded by, we're all handing off. I mean, my PT was like, I feel like this may be a pelvic floor PT. I have a great one for you. And you just keep moving like that. And it's beautiful because you're going to somebody that somebody you already trust vouches for, and that's huge.
That is beautiful, and that is huge. I love that. Andrea, do you think that we need to think about that as certified cosmetic surgery therapists for esthetician at some point?
It's hard to say because I don't know here that esthetician doing. Like I told you, I did the course like 1998. So in Brazil, I think it's maybe different. I can tell you, like, as I learned in Brazil, was esthetician was different than PT, completely different. Like they know like the basic about the skin, everything's like basic. PT is more deep. And like as massage therapist in Brazil was like when I took the course as well, it's more deep as like PT, But I cannot tell you about here. I don't know how the esthetician here, like.
And their scope might be different than what you experienced in Brazil.
Yeah, maybe that one, the scope has been different. Exactly. I cannot tell exactly because I don't know. But in Brazil, usually we start like post-op. Before they start to have a PT, they start with esthetician. The esthetician do post-op there before, like at the back. But now it's more related for PT.
And Andrea, you're highly specialized, and I think most of us here are, including myself. Do you, the push in the United States really, especially for consumers, has turned into I'm going to look for a specialist in X, Y, and Z, right? You started becoming specialized in 1998. We're not doing the math.
Okay,
yeah, right.
Thank you.
Which is a good thing because everybody go see Andrea. She's incredible. Do you feel like we're hurting ourselves as clinicians by becoming highly specialized and not having a lot of general knowledge left in our, in the back of our minds, in our brains.
What do you mean, the physician?
You, me, Erica, Andrea, like as specialists, do you feel like we're just narrowing our scope too much? And then we're sort of we're limiting ourselves from being able to help more patients. Or do you think it's a good thing to be specialized?
I think like Erica said, like if you have like a good massage therapist, you have like a good PTs, like everyone is on scope. But I feel like PT here is like really narrow.
And what do you mean, like PT? When you say PT here, you're talking PT in the United States, right? And what do you mean by what do you mean is really narrow? Yeah, I want to know. We want to know how it's in Brazil.
Yeah, like I can say like post-op in Brazil, I can explain there. I did a lot of things. It's not like an PT scope, but I was able to do it. Like I can help people with nutrition. I can help. I'm not nutritionist, but I can help like supplement because the supplement's gonna help like the skincare, gonna help if the scars, is gonna help to recover, speed up the recovery as well. I can help if like how to take a shower, how to like take your garment off, how to put it on, how many hours you have to do, and like positioning as well. But that's PT can do here. And some point as well in Brazil, like I can determine it when you start like your post op, how many you need it, and how you're gonna do that. So that's in my scope in Brazil to do it. I feel like here the doctor gonna say, "Oh, I'm gonna tell you, you can do like 10 lymphatic massage. That's enough." So I can here like the physician determine for you what you have to do it. But in Brazil, no, I decided.
I love that. And to be completely transparent and honest, when you started talking about what you could do in Brazil and that our scope of practice was really narrow in the United States, I thought you were going to go into the weeds of what you were doing. But really, what you described, everything you described, does in some capacity fit into our scope of practice. For example, we're not nutritionists, right? But as physical therapists, we learn about nutrition. But because we're not nutritionists, we are not supposed to give a lot of nutrition advice. We got to leave that for a nutritionist, which then forces a patient or a client to go seek further care from somebody else and bill their insurance again. And it just becomes this sort of cycle. So everything you described in terms of putting on garments and things of the like, sure, I am not as trained as OTs in terms of to dress and undress, don and doff things, but I think I can figure it out very easily and maybe not do it as well, but I can do it to help patients, right? So I come back to that same question. Perhaps it's not specializing that is narrowing our scope. Perhaps we are limiting our scopes ourselves by just separating our professions so profoundly by things like OTs only do upper extremities, right? We don't do massage, Erica. We don't massage.
Yeah.
We do manual therapy.
Manual therapy. Yeah. Yeah.
Like, let's get real. Like part of manual therapy, doesn't matter how deep or whatever specialized it is they are massage techniques, and that's where they stemmed from. So I really think that it isn't so much that the scope in Brazil is wider and that you're just going rogue and doing whatever you want. You're just able to practice in the way that you should be able to practice.
Yeah, maybe that's a good point. Yeah. Like I said, like if the patient needs like a diet, you go refer the patient to nutritionist. But if you just like a supplement or something, you just can, okay, you know that you have the knowledge. So we can do that. It's not gonna hurt. It's gonna help the patient. So you believe like, oh, to get in and out the garment, you have to see the OT. It's not practicable, you know?
It's not only not practical, it's more money spent by the patient, right?
Exactly.
And more time. And let's say that for sake of a better example, the PT and OT treating this patient now are 45 minutes apart, and the patient has to drive in two directions, and they perhaps only have one car for a family of 5, and they don't have enough money for gas, or they have to take care of the children. I mean, it just becomes a barrier. So I do think there are certain things that we need to, I mean, that are obvious. Like PTs cannot perform transplant surgeries. That's obvious, right? But there are certain things within our scope that we can stretch the lines more without limiting ourselves, not because we want to do more, but to help patients recover better and provide them with what's key, more access to these therapies.
Exactly. In Brazil, I also sometimes I help the doctor to get like I don't know if I told you ladies, like usually the doctor that is right the no micropori. Yeah. Sometimes the doctor asks me, okay, I was his eyes after surgery because he not see the patient like every day as me. So I was his eyes at home. Usually the patient in Brazil at the first 2 weeks I go to his day home because it's like elder said he cannot sometimes he cannot drive, don't have nobody to drive for a day. It's like a lot of painful. It's a lot of stress. No, they just want to recover. So I go to the home and I do everything I have to do just once, you know, to be very easy for they and easy for me as well. So
I think a key also is like getting a good rapport with your surgeon, because a lot of the times, like in my experience, they'll be like, look, this is what you do. They'll be like, oh, the surgeon will recommend, okay, you just had this surgery. I want you to go see, get at least in the first week, get 3, lymphatic massages. And then after that, the patients or clients are looking at me and they're like, how many do you think I need? And I am able to determine based on how they're doing, because everybody heals differently. Some people will follow the protocols to a T and will be on point about what they should be doing post surgery. And some people are just out here doing whatever they want and they're taking longer to recover. So it's nice to have a good rapport where I'll usually email back and forth or text. And if anything comes up, but for my experience, for me, I've been lucky to work with great surgeons is they kind of like, look, unless anything comes up, you do your thing because I trust you. So I think that's really important. And most of them also have estheticians in house that do med spa services. A lot of post-op facelift clients, once they're cleared and months down the road, they'll go back and they'll have estheticians in house that do med spa services specifically.
So another point, nutritionist, but you cannot do that. But some sometimes most of the time when I go to patient house, I work like a psychologist as well because they like to talk, they like to be like. So I'm not a psychologist, but I have to know I have to have some knowledge about it to talk to patients as well. So it's more than just like post op, like the mechanics like post op. Sometimes I go to the patient and they don't I know they need massage like lymphatic massage, but they need like just working their shoulder because they was very, very stressful. The garment sometimes pushes they down. It's like the trapezius is like really tense. So why not work in that piece as well? You know what I mean? That's why I usually work in Brazil as well.
See, highly, highly specialized in everything. She's brilliant.
No, I'm far from there. I have a lot to learn.
I don't know. I think a lot of people disagree with you, Andrea. And Erica, I have to say, I learned so much from you being your partner, and I want to thank you for giving me the gift of knowledge to sharing just a little bit peek into what you know. And I really was grateful to you after that week, and I'm glad that you were my
I
partner
agree.
for that class.
Same. I'm so happy. I was like, I'm hoping she wants to keep being partners, and you did. And I was like, perfect. This is us for the rest of the time we're here. It's us.
And Andrea, good for you for being open minded to learn from somebody who's, as many people, and to be clear, not us, Erica, many people would say just a massage therapist. You have a brilliant mind and so much to offer. I have one more question for the three of you, actually, individually, kind of see what you think about this. So, based on what I understand, Andrea, you've had some, experience in aesthetics and integumentary and all those sorts of things. But based on my other understanding, Andrea and Erica, this was sort of a new course for you. Is that right?
Yeah, yes and no. My foundations are I'm a manual lymph drainer, I'm manual lymph drainage certified. So for me, when I got that, I am also able to work with people in between if they had lymphedema or lipedema, because when they see their CLT and the insurance runs out, a lot of people go to MLD certified people to get that maintenance in between.
Right. And especially when you go to a course that you really appreciate. So let's go with that for you specifically. After 6 days, do you genuinely feel comfortable practicing these concepts, these manual therapies, these techniques on your own without guidance from somebody who knows more than you after just 6 days?
To answer that question, I actually really do. Like before I took this course, I was on it. I turned away some people who were like breast augmentation and stuff because I didn't feel qualified. And after this course, like I really am ready. 6 days is a lot. It's a lot of information. But the thing is, I wasn't learning all this information first time, first sight. Like I didn't know anything. And I think that's what also helped me. And that's the wild thing. Like I feel so confident in like I am going to meet with my surgeon to talk to him about other surgeries that he's doing. So I'm like, I don't want just facelift now. I'm ready.
Do y'all have like a group of people you can talk to about these things and communicate with each other to help continue the learning process? Because we go to school for years, and in 6 days,
Yeah.
we can't really digest and learn everything and be
Mm-mm.
specialists in something.
Mm-mm. Yeah. So I would say to that, like, of course, like with anything, things are come up. I'm not going to know every single thing that pops up in every situation, but I have a great foundation into when things come up. I know what to look for and I know what to be like, 6 days. I really do feel like I'm a cosmetic surgery specialist because when I tell you people are really out here going to people who have no license whatsoever, the knowledge that I have from what I've already had from my MLD plus this. I mean, to answer your question, I do. I really do feel ready. Now, and not to knock physical therapists or OTs or anything, because you guys do go to school for a long time. Besides, like I had my undergrad for 4 years in exercise science, and I had 2 years of massage school, and it's nothing like what you guys go through. But the thing that differentiates me, I can say for myself, than other therapists is I'm a seeker of knowledge and I take a lot of really great courses because I don't want my brain to get bored and I like to read research and I like to stay up to date. So,
And it's within your scope of practice. So no one can ever take that away from you. You are licensed in that area that's in your scope of practice. And that goes back to the conversation I was having earlier with a therapist who turned away the gentleman who was recovering from bariatric surgery. The truth is PTs and OTs can't do it all, going back to what Eder was saying with specialization. But at the same time, we have to acknowledge there are other people who have the scope of practice. And we also need to work together and share the skills. And that's what I loved about this course. The one piece that Nicole brought is an app that we all communicate through. And it's awesome because I get to see the nurses ask their questions and massage therapists and the OTs and the PTs and all these amazing, brilliant minds coming together to answer them. And let's just say, ladies, sometimes it gets a little
oh
heated
my God.
because people have different lenses. And
Yeah.
but that's what makes it good, right? Is that we can have a place where we can ask questions.
Right. That after the 6 days, you have people you can still rely on and speak to and sort of bring each other up because oftentimes, Erica, in our world of PT, we pay thousands of dollars for a course and 2, 3, 4, 5 days, they give you a piece of paper with a certificate and you're certified. And in theory, you're able to treat those patients moving forward. But then again, in like 2, 3, 4, 5, 6 days, it's almost impossible to be certified at anything. So I love that they have that app where you can still communicate with each other, whether it gets heated or not. And heated is good sometimes.
Oh yeah, it's always entertaining. But like you're saying, but not only do I have that app, I also on Facebook and part of post-op groups. Like I'm look at the knowledge everywhere because like at the end of it, everything lymphatics is my jam, which is why I got drawn to post-op because I just love all of it. Down the road, I do want to get my CLT because I do want to work with people who have had mastectomy because my mom is a breast cancer survivor. So I see lymphatics is going to be with me for a very, a very long time.
Well, and you know your stuff. Again, you were a huge, huge benefit to my knowledge for that week. So I'm excited to see where you go. I want to thank both of you for joining us tonight because this was a wonderful conversation. And hats off to Nicole Somas for what she's
Yes.
bringing to the profession. I know it took courage for her to bring this to light and to share what she knows, but she is a leader in this area of cosmetic surgery therapy. And I'm really excited to see where it goes. Hoping that the two of you will reconnect with Eder and I in the future, because I'd love to learn more about what you decided to go. You know, I know, Erika, you said facelifts are your jam. I want to hear if you get into some other area and where that leads you. And Andrea, I'm so excited for what you're bringing to the US, especially in this area, but physical therapy in general, because we need to hear the differences to make things better.
Yeah, that sounds good. Another point I'm gonna share with you guys, I forgot. The Erica just told us about the lymphedema and edema. It's like in Brazil, we don't have a separate course. You can do like as a physical therapist, you can work like in both ways, like post-op and lymphedema as well, like post-mastectomy and whatever. Like here is separate course, right? If I understand right.
We got to go practice in Brazil.
It is a separate course to get your CLP. Yeah.
In Brazil, you can do like separate course if you want, but as a physical therapist, you can do both. So yeah. So maybe I can make a course for you guys.
Right?
Yeah, thank you both. This was I had so many questions because I knew nothing, and so thank you for answering them all.
So I just want to have a quick moment to shout out to Nicole Somas and her book, After the Cut. It's such a good book. I highly recommend it for anyone who is maybe receiving cosmetic surgery, or if you are a therapist treating somebody, it is incredibly helpful, and you can find that online, as well as we will link Nicole's course in the show notes. Thank you for joining us on the Iconic Scholar podcast. If you enjoyed today's episode and want to continue the conversation, don't forget to connect with us on social media as @ScholarNetics360. Make sure to hit that subscribe button so you never miss an episode. And remember, always consult with a healthcare professional for medical advice. Until next time,